Assalamu alaikum, welcome to my channel Pharmacology Made Easy. Today we will discuss about sodium glucose cotransport 2 inhibitors, which is an important drug nowadays used in type 2 diabetes mellitus. We will discuss today on it. The sodium glucose cotransport 2 inhibitors are dapagliflozin, canagliflozin and empagliflozin. This dapagliflozin is first invented in 2012. So the sodium glucose cotransport 2 inhibitors are canagliflozin, dapagliflozin and empagliflozin, and we can memorize their name by their presence of suffix, that is gliflozin. So sodium glucose cotransport 2 inhibitors are canagliflozin, dapagliflozin and empagliflozin. These are the important drugs that control the fasting blood sugar level in case of type 2 diabetes mellitus, and also the postprandial blood glucose level in case of type 2 diabetes mellitus patient. They also causes some weight loss of this obese patient in type 2 diabetes mellitus, and these are the important indications of sodium glucose cotransport 2 inhibitors. Nowadays, sodium glucose cotransport 2 inhibitors can be used in heart failure, the scientists that say. So now, what is the mechanism of action of sodium glucose cotransport 2 inhibitor? How they controls our blood sugar level. This is the picture which showing the nephron, and it is the structural and functional unit of the kidney, and it is composed of renal corpuscle and renal tubules. In renal corpuscle, the glomerulus and Bowman's capsule are consist, and in renal tubules, that is proximal convoluted tubule, distal limb of Lupofenley, ascending limb of Lupofenley, distal convoluted tubule, collecting tubule and collecting duct. These are the parts of the nephron. In the proximal convoluted tubule, segment 1, the sodium glucose cotransport 2 is present, which reabsorb 90% of this glucose, and the 90% glucose is reabsorbed, and 10% of the glucose reabsorbed by sodium glucose cotransport 1, that is present in the distal limb of Lupofenley. So when we use sodium glucose cotransport 2 inhibitors that inhibit the 25% filtered glucose cannot be reabsorbed by inhibition of the sodium glucose cotransport 2 inhibitors. So these glucose are passing through the urine and causes the glycosuria. When there is glycosuria, there is a decrease the blood glucose, and the blood glucose will be and euglycemia can be occurs by using sodium glucose cotransport 2 inhibitors, and that is the control of our blood glucose level. When glucose is out of the body through glycosuria, there will be calorie loss, and this drug can also used as a weight loss of obese patient in type 2 diabetes mellitus. But these drugs has some adverse effect, because glucose is out with urine and glycosuria occurs. So glucose is the important medium for growing of microorganism, because this urinary tract area is very much infected by Escherichia coli, which causes the urinary tract infection, as glucose is the important media for growth of the microorganism. So E. coli can be easily growth in this region and causes UTI. Genital fungal infection can occur due to glycosuria, because glucose is the important media for infection, and glucose is very much important for growth of the fungus. So there will be a vaginal candidiasis, and there will be the fungal candidiasis occurs in case of this type of drug if used prolonged period of time. These drugs also causes hyponatremia, and that produce the dehydration. And another important thing, the rare cause of sodium glucose cotransport 2 inhibitors are euglycemic diabetic ketoacidosis. So what is euglycemic diabetic ketoacidosis? When there will be glycosuria through 25% of the filtered sodium filtered glucose cannot be reabsorbed through the kidney. There will be glycosuria, and there will be decrease the sodium reabsorption. When there is glycosuria, there will be control the blood sugar level and produce euglycemia. When there is euglycemia, there will be decrease the insulin release from the pancreatic beta cell, and there will be increased secretion of the glucagon by the alpha cell, and that's why that causes the decreased insulin causes lipolysis in the adipose tissue, and the increased glucagon causes lipolysis in the adipose tissue, that causes the increase the free fatty acid level, and free fatty acid level causes the production of the ketone body, and the ketone bodies are acetone, acetoacetate and beta hydroxybutyric acid. So the concentration of these ketone bodies is increased, and there will be ketosis, and they causes the metabolic acidosis, and that is the ketoacidosis, that also the liver is produced the excess ketone, and this ketone also increase the ketoacidosis and increase the plasma concentration of the ketone body, that is ketoacidosis, and the excess plasma concentration of the ketone body is found over there, and there is a ketonuria through ketoacidosis, and that is why they call the euglycemic diabetes ketoacidosis, which is a rare cause, or which is a rare complications of sodium glucose cotransport 2 inhibitors, and that is so much dangerous. The one side they produce euglycemia, and another side they produce the diabetic ketoacidosis. So that is the condition, the euglycemic diabetic ketoacidosis. This is the important pathway or important complications of sodium glucose cotransport 2 inhibitors that occurs of it use prolonged period of time. So thank you all for watching this video, and if you get benefited from it, please subscribe. So thank you.